All right, we're gonna just go ahead and get started. So the focus for today's webinar is on how to be a legend for our Be a Hero, Make a Plan campaign. And really the focus is on how to host your own local campaign. And we're really excited just to provide you with some of these tips on how to do that, because we think these tips can apply to just anything that we do here at NPAF that we want you to bring to your community. And so this is, of course, related to care planning, but happy to, go through this in more detail and hear your ideas about what you're thinking about how you can sort of make your own local campaign. So just some quick housekeeping items, just, please mute your lines and enter any questions you have into the chat. Or, throughout the presentation, if you have questions, you can just physically raise your hand or use the raise hand feature. And if you are in a position where you can turn on your cameras and we can see your faces, we'd really appreciate that. Just because I know for me, it's just really helpful to see the reactions that you all have as we're talking through what it is we're presenting. So today we are focusing on the actions you can take for our Be a Hero, Make a Plan campaign. So if you were part of our kickoff call last week, we went through the different levels of actions that you can take for this campaign. So you can be a sidekick, and those are those lower effort types of engagement activities like posting on social media. You can be a hero, which requires a little bit more effort and more of that personal touch to connect with either your friends or your family or just local businesses in your community to let them know about our campaign and our care planning resources. And then the last level here is be a legend. And that's really what our focus is today, on how you can be that legend. And so in our toolkit, we break down, what are some of the things that you can do to be a legend. But we realize this doesn't really, capture all of those things. There might be more questions. And so we thought it would be helpful to have a bit of training to have you all feel confident and comfortable and have any of your questions answered about, what it is that you can do to be a hero to your community. And so we're going to focus today on how you set your own goals for your campaign, how you identify your audience, how you promote your event, and evaluate the outcomes. And we want to start with, featuring one of our volunteers who I think has already been a legend for this campaign, and that's Mo Stewart. I think, Mo, you just got on, and we were hoping to just talk with you a bit about, how you brought Be a Hero to your community. And I'm not sure if you're let me back up here, in a position to turn your camera on. Otherwise, hearing your voice is fine too. So are you there, Mo?
Hi, Melissa. Hi, everybody. I'm here. If I had maybe about 2 more minutes, I think I could find a good spot where I'll have my video and audio. I just need to walk around and find that area.
That's no problem at all. So just speak up, interrupt me once you find that place, and then we can sort of hear from you and talk about, what your experience has been with Be a Hero. So totally fine.
Okay, thanks, Melissa.
No problem. So Mo's for those who don't know, she is in West Virginia in the mountains, the Allegheny Mountains, and internet there is very difficult. And so sometimes we just have to manage with what we can, and that's totally fine. But I'll just get started and just lay a bit of a foundation in just talking about, generally speaking, what is the campaign? We are hosting our Be a Hero campaign this month, and how does that relate to what we're asking you to do as our volunteers in, organizing your own efforts in your community? So in short, a campaign is just an organized course of action to achieve a goal. in this sense here for NPAF and Be a Hero, our goal is to normalize care planning and to just sort of, again, pick up or just look more broadly at what, campaigns are. You can have a marketing campaign. I think Share a Coke is a great marketing campaign that people recognize. There's also, back in the day in the 90s, early 2000s, there was the Got Milk ads. It's not delivery DiGiorno. I'm sure you all can think of just some really good examples of, these marketing campaigns. Of course, we have political campaigns, and a lot of what we do in the advocacy space sort of borrows a page from, the playbook of political campaigns. And, back in 2008, when Obama was running for his first term, his Yes, We Can, his message of hope was something that really resonated regardless of whether you supported him or not. Everybody knew that campaign. It was, in that sense, really successful. And then there are awareness campaigns. There's a lot, of course, with voter registration, Rock the Vote, how you get the vote out to young people, or how you get young people to register to vote. Also, there's been a lot within the, reducing plastic use space, converting people from using, grocery store plastic bags to their own bags, getting rid of plastic straws. That has been a sort of a grassroots movement that has been really, really successful, in that it has, prompted a lot of businesses to change how they change their practices. And that's, again, thinking through what you want to achieve. That is what will make like a very successful campaign. So I kind of plotted out using, again, that page book from, political campaigns and how they organize, what are the types of campaign actions that people can take. And so you have, things here, and this was me just sort of plotting these dots in a way that I thought made sense. The different axes here are focused on impact and effort. And it's sort of how we tiered out the different levels of, what you all can do as volunteers for the Be a Hero campaign. It's how we sort of figured out what's the sidekick, the hero level, and what's the legend level of actions that people can take. And so, those sort of high impact, low effort actions are, here in this first quadrant, that's posting on social media, or maybe writing an op-ed or a letter to the editor and to your local paper. And again, this sort of just depends on what people's comfort levels are, like, as far as, are they more, comfortable with, hanging the flyers? Maybe that might not be such an effort in a type of campaign action that they can do. And of course, you have like organizing a town hall, phone banking, hosting small events. You could probably even throw in fundraising if there was a fundraising element to what we're doing. But, snapshot, here's just generally the levels of actions that people can take. And really we're focusing on this, second quadrant here of, high impact, high effort work. And that's really what makes these actions legendary. And so just to move forward, and I'm gonna just pause to see, Mo, if you're available, if you found this spot yet. If not, I will continue going through the presentation.
Okay, I think so.
Okay,
I'm just
perfect.
do this over my phone, so it's going to be kind of wobbly. I'm sorry.
It's no problem.
So I see a lot of names I recognize. Hello to everybody. It's nice to see you. So I think Melissa wanted me to talk a little bit about the campaign that we've done here in my community. As Melissa was saying, I live in West Virginia in a really small rural community that has a lot of elderly people. West Virginia has the most residents over 80 of any state per capita. So we have a really, already have an underserved population because of where we live. Most people drive a minimum of about 2 hours to any doctor's appointment that they have, if it's a specialty appointment or a consult with anybody other than their local primary care doctor, if they have one. So another thing about our culture here in West Virginia is a lot of people live here because they want to be off grid. And with that comes a level of stoicism and also a little bit of, they're probably a little more private than most people. They just kind of don't want to be bothered. They want to be left alone. These are the kind of people that, you know, maybe go to the doctor maybe once a year to get a physical. And unless something is wrong, they don't really engage with members of the healthcare community on a regular basis unless they have a chronic issue that they're dealing with. But until that time comes, they don't spend a lot of time engaged with anybody in the medical community. The children here and the parents rely very heavily on the school system to do things like dental screenings for their children while they're at school. And also the school nurses, unfortunately, they kind of serve a role as a lot of the children's only health contact unless they need vaccinations or something. So we're dealing with limited resources already. And then I think roughly 60% of West Virginia's residents are on some kind of government subsidized healthcare. So really underserved population. The thing that's unique about my community is I live at a ski resort and we have a lot of retirees here. So people from different states who have bought property up here at the ski resort and then they retire here. One thing that made that challenging with COVID was we have a lot of people up here who live very far away from any relatives that they might have. And so when COVID started last year and probably late spring, you know, we were all still curious about how it spread, what was the right course of action. Of course, we were told to stay home. And I was starting to hear a little bit of chatter from people here about, you know, I don't know what I would do if I got sick. Should we contact our lawyer? What do we do to make our needs known? And then there's always that degree of people don't want to talk about care planning or end of life decisions or anything like that unless they have to. So after a few weeks of hearing that kind of chatter from people, a lot of people here know that I have a healthcare background. So when they have general, just kind of questions about anything, they'll ask me. And it was a pretty, I was getting questions about those things pretty consistently from people in the community. So one of the first times that we all decided to gather safely was at the local farmers market, which is where a lot of people get their food here. So at the farmers market, I decided to do a care planning workshop. I mean, really informal, kind of impromptu thing. A lot of our elderly residents go down there, or people who are you wouldn't consider elderly, but maybe in that age group of they're retired, but they haven't had any serious healthcare diagnoses where they've been forced to think about care planning or things like that. So we have a large community of people like that. And I set up a care planning workshop where people could just ask whatever questions they had about care planning, where they needed to go to find resources. A lot of people thought that if they didn't contact an attorney or do a care plan with their doctor, then it wouldn't be a legal document or it wouldn't be worth anything. And a lot of people also, one of the misconceptions that I heard a lot was people were confusing a care plan with a will. And so I think you'd be surprised at how many people who have never thought about this topic, how many of them have really just easy questions that they're really not sure of. It's not a topic people really like to think about or talk about. But one of the things with COVID was we all had a reason kind of unexpectedly to start thinking about these things, and people really took it seriously, especially at the beginning. So we had about under 30 people. There was 20 some odd people at the first one that we did, and I just I used the toolkit and various resources from the internet, NPAF.org. Really just broke the ice with talking to people about what counts as a care plan, contacting someone to let them know you have implemented or you've started to establish a care plan. So letting your friends and family know that you've done that, or someone that you trust, letting them know where it's at, and how to get your healthcare team on board with that, and really just giving them the basics of how to communicate their healthcare wishes to their friends, family, and healthcare team. We didn't really go too far off the fundamentals of that, because for a lot of these people, it was the very first time they'd ever had a conversation about that topic. And really, if you have kind of an elementary base knowledge in what a care plan even is, I think that answers the majority of questions for people. I know that every state has its own laws and rules and regulations about advanced directives, and that's another thing people tend to get confused about. They think that unless they're going in the hospital for a surgery and the hospital hands them a paper to fill out, then it's not a legal document. So really just taking the time to answer those questions, kind of give a little preface the questions with an explanation about what a care plan is and all of the things that you can kind of mitigate through care planning is a really good way to start out. And I try to leave individual questions or things that are really case specific or person centered. I always try to refer those questions to the person's healthcare team or doctor. And I always like to reiterate too that care plans are not about money. There's one level of being uncomfortable talking about care planning and end of life care and palliative care, but really stressing to people that a care plan and a will are separate. It has nothing to do with finances. That tends to break the ice too. People are a little bit, they relax a little bit when they know that they don't have to be making financial decisions. So I think that would be the best advice that I have, and really kind of tailor it towards your community. It's worked out really well for me. And now I know that most of my neighbors have a care plan in place. So even if I see the ambulance at their house one day, I can, let the EMS crew know that I know they have a care plan in there, so we can do our best to make sure that their wishes are implemented and maintained during their healthcare crisis or their hospital stay or whatever's going on. It's nice to know that people have done this in your community. So that would be my advice.
Thank you, Mo. That was so wonderful, everything that you just went over. And before I move on with some of the slides that I have remaining, I just wanted to open the floor up to see if there are any specific questions for Mo.
I don't have a question. I do have a reaction, and I thought Mo did a great job. I have talked to a couple people since we had our last webinar about like, hey, we should sit down, like I can help walk you through this. And I've gotten a lot of hesitant reactions. And so she answered a lot of questions that I had. I think that it is a really hard conversation to have with people. And I'm hoping that in today's webinar, I can kind of mold my pitch a little bit better so that people don't freak out when I say care plan. So.
Yeah, no, I think that's great feedback, Brittany. And I'm hoping we can answer that if by the end of this. Tony, I saw your hand up as well.
Thank you. Hi. I was interested in something that Mo said, which I just wondered if we could discuss a little bit more. The the issue of, as a neighbor, as it were, watching an ambulance arrive at one of your neighbor's house or somebody down the road, what are the techniques or what are the recommendations to give to people as to how the caregivers or the emergency responders know you have a care plan, and where is it? And I actually had a neighbor 2 weeks ago who was rushed away in an ambulance, and before I could even think about it, they're gone actually. So I had no idea whether they had a care plan or not. So Mo, I'd just be interested to know if you could share your expertise on this.
Okay. Can you guys hear me? Can you see me?
Yes.
I'm chasing the internet. I'm sorry. Hi, Tony. How are you? It's good to see you. So my community up here, again, is kind of specific to my community. We have months where we can't get out of the driveway. So we send the bravest people with the biggest snow tires to the store, kind of for everybody. So we're all really kind of interpersonally connected. I could see where someone like you, Tony, like, in the Bay Area in California, you might not know all of your neighbors, but so for us up here, what we've done is we have a homeowners association, which I realize is pretty unique to our area too. But if somebody taps you as their, the person that they want, their wingman, so to speak. I have various friends and neighbors who they have care plans, and we just pick a designated spot for them, and I know where it's at. So watching an ambulance arrive at my neighbor's house, they're only going to one hospital here. There's not a whole bunch of options like there would be if you lived in a big city. So if I can't catch an ambulance or people are rushing down to the hospital, it's not really that big of a deal to get it right then and there in that moment, because we know where they're going. That's not true of everybody else's community, and I realize that. But I will say, on that note, Melissa and Mary and I have been working on a project with an alliance called Homes on Wheels Alliance. And so just as an example, Tony, of how you can talk through that and make a plan for knowing where those care plans would be located. So the Homes on Wheels Alliance, it's a group of people who are houseless. They live in vans, RVs, cars, etc. Most of them by choice, but some of them not by choice. They've lost jobs, homes, especially during COVID. And we have been talking to their director, a man named Bob Wells, about establishing care plans in their community, and also trying to launch a campaign of just kind of making people aware that if you have a care plan, it'll be in a specially designated colored envelope. We picked teal for them. So a teal or turquoise envelope, and look in the glove compartment of the person's vehicle. So I really think that communication is key. And if you have friends or family that you're their lookout person, or they're yours, really communicating and reminding each other, updating each other if you've moved it. But yeah, this is where communication really comes in handy. If everybody knows where the care plan is, then you're not scrambling at the last minute. If you update it or you need to move it, letting everybody know. We do that on my birthday every year. It's a nice reminder that I'm alive. Update the care plan, make sure everybody knows where it's at. So yeah, again, it's really specific to my community, but I think if you establish a plan, not only can you be a hero, but you'll know where your care plan is when you need it. So that's probably what I would do.
Interestingly, we do, the community, the immediate community that I live in is actually it's a suburban rural one. It's not downtown San Francisco. And our biggest problem around here is we're right on the front line of fire season. And we have recently, as a local community, established a sort of neighborhood watch system for fire prevention and reaction in the event of a fire. And it strikes me, just thinking about what you were saying, that they're not, although they are separate events, knowing where your care plan is in a fire situation is equally important. And we have, especially for the elderly residents, which there are many in my community, we have a very simple system of saying they need help in the event of a fire. They cannot evacuate on their own. And I'm just thinking that something could be piggybacked onto that system for knowing where their care plan is as well. And now I think about it, we have an organization which goes door to door to help people prepare for fire. So it's getting my thinking going. So that's great. Thanks very much, Mo.
You're welcome. Just one more thing on that, Tony. Being a California native, CAL FIRE and the BLM in California specifically, they have programs in some communities. I grew up in Tuolumne County, which a huge fire hazard every year. But CAL FIRE and the BLM firefighting crews there, they in some communities have fire safe programs where if you have documents or things like that are healthcare related, like, you know, if you have a medical alert bracelet or special instructions, you can go to your local CAL FIRE or BLM office and they can point you towards organizations. If they don't have the fire safe there themselves, they'll take down specific healthcare information about your address and log it in their database, basically. So if they show up to your house, they might know that, you know, elderly people live here or a person with diabetes lives here. And that's something that they established when I was in high school, but it might be community specific, but it's worth looking into.
Yeah, so we have something similar here, and many communities in Northern California now have these. And so I'm thinking of piggybacking on that. It's getting my thinking going. It's great.
Thank you both. I'm looking at the time, and Mo, again, thank you so much for just sharing your experience. You are someone who just can speak about care planning just in a way that is just conversational. It's not off-putting, and you can just see your passion. And thank you again just for being our guest and sharing what you've done for your community. And just hoping taking everything that you've shared and just applying it to what others might be able to do in their own communities. Put these slides together just to help jog people in the way that Tony just described, just, begin thinking about like what it is that you might want to do. And so really the first thing to any sort of campaign or any sort of level of organizing is really just setting your own goals. And just to keep in mind that it's, to be realistic. And so some things that you should consider, just how much time you have, how much effort do you want to put in, how many people do you want to reach, who do you want to reach, and what kind of campaign action are you comfortable with? And so some examples of, what the goal could be is, I want to help 5 people start a care plan this month. That's awesome. I want 10 organizations or businesses to share NPAF's care planning guide. That would be a really great goal as well. Or I want to help, 3 people who live in, an area of my community that's underserved, know more about care planning. So those are just some examples just to think about, what you should consider when setting your own goals. And I want to just pause here and see if Mary, if you wanted to add anything here.
No, I think this is great. And I think, what Melissa's mentioning about, not only who do you want to reach, but sort of what is within your reach. And, because we are in a pandemic, a lot of our outreach is going to have to be digital, which, does eliminate certain hard to reach communities. So when you are being digital, you can even create, campaign style, a small phone banking list. You can write down 5 to 10 or so different organizations that are dedicated to reaching hard to reach communities, like the Boys and Girls Club, for example. Organizations, small or large, it could be your local HHS, and connect with them about care planning and see what you can do to sort of support their ongoing efforts or create something entirely new if they haven't necessarily thought of care planning, and walk them through that process. Those are some of the best ways that you can do that. And phone banking, while it may be daunting, it really doesn't take that much time either. And you can have a significant impact with that alone.
Yes, thank you, Mary. And I think you hit on, again, just that, the next step here is to, in identifying your audience and who you want to reach. And as you just so rightfully, acknowledge what's within your reach. And so some things to consider here are, who NPAF has identified as, our target audience for this campaign. That's young adults, underserved groups, and patients and caregivers. Some other things to consider are, your own sphere of influence. Are you a part of a book club or a support group, or, are you, an active member in your church? Use that and leverage that so you can help compel other people to, know why care planning is important. And again, think of what your comfort level is. And just hearing some of you all share last week when we had our kickoff call, just sort of the level of, the comfort that you're, willing to reach. Maybe it's just people your family, your friends, your coworkers. But maybe some of you might be more comfortable just connecting with members of your community. Maybe it might be uncomfortable to talk with your family and friends about this, right? And so, just sort of weigh those two options and see, what's my sphere of influence? Who would care about this? And, what's your comfort level? So you're not, again, it's about being realistic. It's about just, setting the right goals. And so keeping that in mind, deciding, what your campaign actions are. And this is, these are options laid out here for people And, some things to consider here is, how much effort you want to put in, what kind of impact you want to make. Some of the things that you should do up front, are make up that list of people who, again, either or who should be interested in making a care plan. Select the date or dates that you want to, host an event, and send invitations. Of course, the last two are, is if you really want to do that sort of that event level of, organizing. I know Mary last week, she sort of described these different actions already, but, it could be just setting up your own personal office hours and letting your family and friends know that, if they're interested in wanting to talk about care planning, you're available, and, they can set up, times where they can, walk through our care planning guide with you as support. And I know in thinking about our Get Covered campaign, where that is focused on enrolling people in insurance and, having them understand, what the difference is and how, just overcoming a lot of the things that are confusing about enrolling in insurance. The same sort of thing can be applied here. You can help people one-on-one start their care plan. And, if you take a look at the resource that we've created, hopefully that should, again, make it so that it's not so threatening. And I'm keeping your question in mind, Brittany, because I'm not sure I answer it specifically in these slides, but I want to hopefully answer that by the end of this. I guess another way that we've suggested as a way to bring this sort of personal sort of campaign action you can do is to host a virtual get together. We know not everyone's vaccinated yet, so we can't really have the in-person get-togethers. But in thinking about like political campaigns for people who are supporting whether it's a local campaign or even presidential campaign, sometimes they hold these get-togethers together. It's a bit of a fundraising effort. Think of it in that same way. And one of the things that we had suggested if you were to suggest a virtual get together with your family, your friends, your coworkers, maybe carving out, an hour of, the last hour of the day and connecting with your coworkers and making it about care planning, you have to try to have some fun with it. And so we came up with like hashtag coffee and care planning, or, cookies and care planning. And, we know a lot that, over this last year, there's been a lot of focus on self-care, and making a care plan is, in my opinion, self-care. So you can, turn it into self-care planning. And you can also make it a game. So there is, for some of our volunteers who have been with us for some time, know about the conversation game Hello. And it's something that we've provided as a resource to our volunteers in either, I think, a previous patient congress, or maybe just some even one-off instances if people were holding community workshops. But Hello is again, it's very much like our care planning guide. It's a sort of a prequel to sort of the advanced care planning conversations that feel a little more daunting for people. And we find that a lot of people who end up playing the game actually really enjoy it. They may be a little, not interested initially, but after going through a couple of the questions and hearing other people respond, they begin to embrace it more. And there's a web sort of virtual version to, if you wanted to sort of break the ice with using Hello. This one's the web version is called Hi, but commonpractice.com is where you can find these resources. But yes, that's another option of just, making care planning, I guess, a bit fun. And, it sounds weird to say that, but we think there's a way to just, again, I think that comes with just trying to normalize care planning. And Mary talked about phone banking, and I think this, this actually sort of hovers between, actions that you can do for your community and actions you can do with your friends and family. And for those of you who've been around for our Get Covered campaign, we had at one point talked about, building street teams and having street teams go out into the community and share our Get Covered resources. And this is sort of the same idea, but it's, again, something that you can do from your home. And, with group phone banking, as Mary indicated before, you can come up with a list of organizations or groups that would benefit from knowing this information, and then maybe gather a couple of your friends to be like, hey, let's, all tag team and call these different organizations together and see if they are able to, post NPAF's care planning guide on their website. And we've even seen some, I think, in the last presidential election where they would do these types of group phone bankings, but also make it a virtual event where people would be on the phone, but can like see everybody doing it. And it really does end up building that community, which we think is really important in any of the campaigns that we do. So those are some examples of just, how you can organize for people, now, thinking of actions of what you can do for your community. Again, it's thinking about, who your audience is. Do you want to, do you want to go big? Do you want to, try to reach as many people in your community, many groups as possible? Or do you want to be targeted? Do you really want to hit those groups who don't know about care planning at all and may not find it with the resources that we have, which a lot of them right now are focused on going online. Maybe there's some just areas in your community that just don't have that internet access or that broadband access. And so, for that reason, they need to, you need to bring the resources to them. So again, thinking of like, I think if you want to do that sort of, community organizing, I think that sort of answers, the amount of effort you want to put in and what kind of impact you want to make. That's that high effort, high impact. Those actions is what you're interested in doing. So some of the things to do to prepare for this level of organizing is, again, make a list of the groups who are interested or should be interested in care planning, selecting the dates, developing an agenda, and sending those invitations. And, some of the examples for the types of campaign actions that you can do that relate to, organizing in your community is that virtual town hall meeting or that workshop. And, in this, I honestly think the best way to pull off a town hall meeting or an educational workshop is to partner with another organization, so it doesn't feel so daunting and you already have a ready-made audience. And then, then there's the other option of, meeting people where they are, and physically, if you feel comfortable doing that right now, because we are still in a pandemic, physically printing out of copies of our care planning guide and dropping it off at locations where people might access this. And I know in some of calls we've had with some of our volunteers previously, homeless shelters was, a one, is an underserved group that, should have something, something tangible. This could be, in food pantries, the YMCA. I think the Boys and Girls Club. I had meant to write that down. I think that's a great, great option. And let me just move my thing here because I'm not seeing my last part of my deck. I think, oops, sorry about that. Anyway, you can see the different, places where you can reach out to. And I know, there might be others, and you're welcome to share it here. I know Mo mentioned how, we've been working together and sort of thinking through, over a period of time of like, how we really build this group that's a part of the Homes on Wheels Alliance to sort of standardize where they keep their care planning, how to get the sources. And she had mentioned, even a place like Staples or FedEx, where they may go one-off to use a computer or to, print something out. That's a helpful place to have this resource available, because again, it's about reaching communities, and, libraries is another option. And so I know we've had this question before about just examples of community groups. Some of you had indicated, like, who should I talk to in my community about care planning? Who would be interested in this? And we have just some examples here. There may be others, and if you guys on here listening, participating right now, have other suggestions of that's not listed here, I'd urge you to just drop that into the chat. But small businesses, employers, I think are really great groups to connect with, especially, in my opinion, this is a type of information like the HR department should be providing employees, along the lines of, when it's the open enrollment period for, signing up for insurance for their, the company, maybe they can also think about care planning. And, small businesses, of course, need this information as well. Community colleges is just a great place to connect with, and, maybe it's, either, whether you want to, offer, doing some sort of care planning type of workshop, or just leaving the resources there, or setting up a time to just have a focus group or a town hall meeting with, people at, it doesn't have to be a community college or any sort of, college, to talk about why care planning is important. That's a great way to connect with that young adult audience. I had mentioned homeless shelters already, food pantries, senior centers, hospitals, of course, insurance brokers, there and local area agencies on aging. And I know Mary mentioned just local, health department is another great great option for just who you can partner with and who you can bring our resources to, and sort of go from there to figure out, is it me just sharing the resource and asking them to post it on their website, or do they want something more and, holding like an educational workshop or being available for, if there are questions from their members or their constituents about care planning. So those are just some examples. Now, as for getting the word out about your event, again, it really just depends on what type of action you're hosting and how many people you're inviting. Good old-fashioned, old fashioned, right? Good old fashioned email is, probably the best way to connect with family and friends, and, just talking about, with everything that has happened recently regarding COVID, I think it's really important for all of us to be prepared, and, want to share this resource. And if you guys want to do this together, wonderful. And again, make it fun if you want to. And we know some of you, some of our volunteers are really active, on Facebook, and may even have, your own Facebook group, or, Facebook is a great way to just, post an event and, have others see that, you're focused on, doing this sort of care planning initiative. Eventbrite is another way to promote your event, and that's especially if you're doing something within the community. It gets a lot of eyes on your event, so there may be people who you weren't initially targeting but may see it on Eventbrite, because Eventbrite it pulls all of the different events for your area and shows it, and that's a great way to just connect with people. And then there's also just going out into the community if you feel comfortable, and hanging flyers, because email, Facebook, Eventbrite might not be options for people everywhere. And we want to make sure that, especially with reaching the underserved, that there's some way, some level that they are getting this information about care planning too. And lastly, evaluating the outcomes. Think back to your goal, whatever it is that you set out for yourself, that we hope is realistic, and just ask yourself, at the end of once the event's over, if it's something that you are doing over the month of April, did you meet that goal? And then we also have an evaluation survey included in the toolkit that you can complete, and we can sort of capture that and let you report back at the end of this campaign to see, what the impact was, and what you all did. And I added a tip here, and once your event or once your action's done, there's an opportunity also to write an op-ed and still promote it, somehow, and share that outcome. For those of you who have attended Patient Congress, I know years ago that we would have some volunteers who would write a letter to the editor in their local paper saying that they participated in National Patient Advocate Foundation's Patient Congress, and that it gets buzz. And there's a very key audience that letters to the editors reach, and it tends to be a lot of time policymakers, and that's an influential bunch. And so that's it's not something we want to not have be a part of this. And just a little tip that I want to make sure that you all remember, that it's a win in our book if you just help, if you help just one person. I know some of you may have sort of moonshot goals, which we of course really appreciate and we love that. But we don't want you feeling discouraged or anything like that. If you find that your Facebook post isn't reaching as many people as you'd hope, just helping one person start their care plan is a big deal. I just saw, just got an email from Health Affairs saying that, advanced care planning is still not something everybody has embraced. And we're hoping some of the work that we're doing here with Be a Hero, Make a Plan will change that. So real quickly, just some key messages that we want you all to keep in mind as you're talking about care planning. I think the one that has really resonated with our volunteer audience is, making a care plan is as important as enrolling for health insurance. We want that to stick, because again, that goes to just normalizing it. And we want to make it easy to talk about care planning, and that anyone can start a care plan. You don't have to have a lawyer present. And that a care plan, in its simplest form, allows you to have a say in your care. And in our care planning guide, we include an FAQ section that we urge you to use as you're, talking with others about care planning, because it's just, again, really helpful just to have those words to describe, what questions these people have. And so I'm going to pause there before I go too far. I know we have a couple minutes left, but just want to see what questions people have. And Mary, if you can sort of help me find questions, or people just,
Oh yeah, of course.
you're welcome to just raise your hand too.
I also have a quick note. Just want to spend a minute or two really quickly to touch on, or to really reinforce what Melissa was saying earlier, and to touch on Brittany's question earlier. So I think you really do bring an important point up, Brittany, about, you know, how to make this conversation less intimidating or invasive. And there really is a small art to being disarming with this type of campaign. And the best example I can come up with is really sort of aligning it with voting, because that can also come off as invasive. And some of the best ways that I've learned to be disarming is to either talk about yourself or your family. So, you know, in campaigning, when you're knocking on somebody's door and it's somebody who, you know, has toys in their front yard and who's in their 40s or 50s, you're assuming, okay, this person is likely a parent or is caring after children. So how can I tailor my message to bring this important message forward? And with care planning, with that particular audience, you can talk about, you know, not only you know, you want to make sure that whoever your emergency contact is, whoever your backup person is, that they feel prepared and that they don't feel overwhelmed with the fact that they're not a nurse, they're not a doctor. Even if they are, they may not. Being a caregiver is a completely different playing field, and making sure that they're armed and prepared with the information that they know how to best care for you. And with voting, it's also something that I think we've all grown accustomed to because it happens every 2 years or so. And with care planning, one of the best, you know, things that we have at our disposal is the pandemic. This was completely unplanned, obviously, and there's so many people that are so concerned about their health and well-being of their friends and family. And I think bringing up, you know, care planning now, it's a little bit easier for people to sort of grasp the importance of their health and the importance of making sure that somebody else knows how to care for them in that sense. So I think, you know, talking about you saying, you know, I never really thought about care planning ahead of the pandemic because of X, Y, and Z, or, you know, I had this conversation with my mom, and that in and of itself becomes immediately disarming because you're so willing to share so much about yourself to make it a little bit more comfortable to speak with somebody else about it.
I think that's great. And that was super helpful. And I think the thing that kind of like set me back a little bit was we kind of have this like group of people that, okay, well, let me start again. So the person that I interacted with is very medical, like anti-doctor, like anti-medicine kind of mindset, which I can understand because my sister is a very holistic approach type person. And I feel like when I posed the idea of a care plan, you know, they were kind of taken aback because they're like, well, I don't want any medication. To which I said, well, that's why it's important to have a plan like this so that people know the way that you want to be cared for. God forbid something happens to you. So you can put that in your care plan. But I think that maybe if you or Melissa are available at any time, like before next week, maybe we can set aside a time to discuss it in more detail, just so I can feel more confident, like, because I do want to reach out to more people. I just got a little nervous after that interaction, and I just want to make sure that I'm not making people feel uncomfortable. So.
Absolutely. We totally get that. And thank you for sharing that example, Brittany. And Mary, that was so wonderfully put. And I think just that parallel to voting is a great way to describe this. Any other comments, questions, or just ideas of what you are planning to do as you think about being a legend in your community?
Melissa, this is Tony. I would suggest or recommend to folks who are starting to contribute in this that in addition to, you mentioned email, Facebook, handing out flyers, etc. Although this, I expect a lot of people have encountered Nextdoor, which I think is a nationwide sort of local organizer. Well, it's nationwide, but it's in every community. And although it's in some respects quite annoying, but it does actually reach the community right down to your local block. And it's very easy to access. I've actually found that I have more impact on Nextdoor than I do on Facebook. So I just share that with everyone.
Yes, Tony, thanks for sharing. And I know that's come up a couple times now where people are saying that, you know, the information that we're trying to get out there resonates more with people on Nextdoor. And we get that because it's, you know, it's at that local level of just information that we're trying to, you know, share. Sometimes, you know, with Facebook, it just sort of seems that you're just putting something out there to the, you know, the ether. But I think that's helpful, Tony. But yeah, what I had indicated for just, you know, promoting your events, you know, that could, you know, in any sort of, or whatever your campaign action is, right? You know, those are ways that that you can do it, and you can substitute, you know, a Facebook event for any, you know, whether it's Nextdoor or any other social media.
Yeah, thank you, Tony, for sharing that. I think Nextdoor is incredibly smart because people who have that are likely very interested in things that are going on locally as well. So people, I imagine, would have far more success with the Nextdoor app. So we appreciate that.
This is why, and I was just going to share, one of my events will be a memorial for my husband's birthday on April 21st. So I have already started doing Facebook or social media questions, asking people to join my Matter family for care planning. And I'm just going to do a live and ask people to chat, and respond as one of my events. And I also will be doing a live event with my caregiver support group. But I was just saying that because some people may want to attach a fond memory as a way to memorialize a family member or friend based on the Be a Hero, Make a Plan.
I love that, Why. Thank you so much for sharing. And if you want to, you know, share it with us so we can post it on our, you know, NPAF Facebook group, you know, or I think you can post and we can approve it. Just, you know, we're happy to do that just to get the word out. But I think that's a fantastic idea.
Okay, I will do that. I'll put it on our Facebook page.
Great. Okay, I'm seeing we're, you know, just a little over the hour, but just want to make sure that we see if there are any final comments, questions from people here. I'm hoping this was helpful. All right, hearing no comments. Let me see, just want to make sure you all remember that next week, April 12th through 16th, is our week of action for the campaign. So this is where we really want you all to just ramp up, getting the word out about Be a Hero, Make a Plan. And again, if you refer to our campaign toolkit, we have designated actions for each of the days. And April 16th is National Healthcare Decisions Day, and that is the day where we want all of you to show up on social media. And there's a printout that you can used where you can just complete, why, care planning is important to you. We want to see all of your faces and see your responses on social media. And then of course, we have the week after really open just to see for those of you who want to do those legend level actions to use that week to do it. And then we wrap up the campaign on the 29th. So that's really all we have today. Thank you guys so much for participating. Mary and I are available if you have additional questions. I know, Brittany, you wanted to reach out, so just, don't hesitate to just shoot us an email. We'll be happy to circle back with you. And that goes for anybody here if they have any more, specific questions as it relates to, your local campaign actions that you want to do. So thank you all and have a good rest of your day.
Thank you.
Bye.
Thank you. Bye-bye.
Bye.
Bye.